Dr. Deepa Verma joins us now. We're going to go in depth on some of the latest research into the coronavirus. Welcome back, Doctor. We already know all the common sense things we've heard a million times this week alone. Wash your hands, you know, all the things folks already know. But we want to look at what some of the latest research is showing about this virus. And there's some new research out on the duration of the virus in the body and how long people can be contagious. What are we finding out?
So what we're talking about is the viral shedding process, and we're looking at now more the asymptomatic people, not just focusing on the people who have the symptoms. So what we're really worried about is the carriers, and we're finding that the people who are asymptomatic are shedding very, very high amounts of the virus, and that's what's concerning us. So we're trying to look more into PCR testing, which looks at the RNA fragments that are shed in the virus, which is how the virus replicates. And we're also looking in other tests to look at sputum, blood, urine, stool to see are there other ways we're transmitting this without us knowing.
And they're finding in this research that there's a longer period of time for viral shedding. And viral shedding just refers to basically how long is it coming out of your body and making it so that other people could pick it up and be contagious. There's a longer period, it seems, for coronavirus on this.
So there is research that's been starting, coming out of like Germany, et cetera, that's showing that the viral shedding is peaking much earlier, and we're developing antibodies, and that's why people can go longer times being asymptomatic. Whereas if you look at the SARS or the MERS, there was a much later shedding of the virus, and that's when it was already down deep into the lungs. So what we're seeing is we're shedding it, starting to shed it earlier, and it's much more prolonged. And this is another concern because people who seem to have recovered from it are still testing positive a couple of weeks after. So we don't even know how long the incubation period is from the time the symptoms, you know, the onset and when the symptoms show. And that's concerning us as well too, because we're not sure how to monitor this. So there could be thousands and thousands of people out there who are walking around carrying it and infecting others. And again, we talk about the airborne route of transmission, which basically means it lingers in the air, it lingers on surfaces. We talk about metals and cardboards. You know, anything that we touch, it can be on there for hours. And again, like I said, if I cough or sneeze and nobody's in the room and someone comes in after a few hours later, they can still catch it that way. It doesn't have to be from me.
And some folks might not have it at all, might not know or have any symptoms whatsoever, but yet they are actually shedding this virus. And compared to the flu, viral shedding for the flu, or the amount of time you're contagious for the flu, 5 to 10 days. This research out of Germany, the median duration for coronavirus, 20 days, even some folks having it up to 34, 37 days. So when we're asking folks to self-quarantine for 14, that may not be adequate.
No. And that's what we're looking at. This is why now, because we're in a state of national emergency, the Stafford Act has been enacted and invoked, we're looking at really quarantining ourselves. At least it's going to have to be 2 to 4 weeks, because if it's going further than that and we're shedding the virus past 14 days, that means it's still coming out from us. And whether you're symptomatic or not, that's going to be the route of infection for a lot of people.
You know, when we talk about these things, I recognize that this is scary for some folks to be going through this right now and hearing all this, and there's so much information coming out that you just feel almost like it's nonstop, and now you have new research about how long it could last. So let's take a breath and talk to people about what they can do in addition to those common sense things and following the CDC, just to kind of give their own immune systems a leg up, a boost here.
So basically, as an integrative MD, I'm seeing this on that side of it, because I'm not, just sitting in the office and just kind of screening people. People are coming to me because they want to see how can I boost my immune system, can get a leg up, and just get in front of it. So there are a lot of immune things, you can do. The supplements are going to be a huge thing. Anything like there's certain herbal supplements that are very potent and powerful that can basically inhibit viral replication. I use a lot of peptides. There's something called thymosin that I've been putting a lot of my patients on. And just a lot of these herbs, there's andrographis, there's elderberry, there's the medicinal mushrooms, there's indigo woad, and a lot of these things target the lung. This is where this virus is now settling in, and this is how people are actually dying, if they're immunocompromised, because they're going into respiratory failure, they're developing pneumonia, they have to be on a ventilator. So using these tactics to basically get ahead of the game is going to be key. So I have an IV therapy is huge. I'm doing tons of it in my office, just doing things to boost the immune system with high dose vitamin C, glutathione. Those are going to be the key factors. I just want to remind people there is no cure and there is no vaccine. Viruses don't die. They lay dormant in the body and they can keep getting reactivated. The problem with viruses is they contain RNA. That's how we are, the RNA fragments is how we're monitoring them basically. And they rapidly shift and mutate, and they take host inside a human cell. And they use the cell to basically replicate. And that's why it's very difficult to develop vaccines, and we can't develop cures for these. It's really symptomatic treatment. So again, flattening the curve. Social isolation is going to be key now. Avoiding big get-togethers, even little things, play dates, going to school, going to the stores. We're going to see a lot of delivery services, getting now into action. Those are the preventative measures that we have to do. And I keep saying it over and over again. Wash your hands, sanitize things, avoid being around people if you think they're sick. I had a patient today who said, emailed me and said, I'm coming in for my 4 o'clock appointment, or I have a 4 o'clock appointment, but I have a fever of 100.4. What should I do? Stay at home. Telemedicine is huge. Now with the Stafford Act being invoked, this is creating a lot more leeway in the medical field where there's going to be less restriction on physicians and able to be practicing maybe even out of state, getting hospital privileges. Telemedicine is going to be huge. So I'm just making all my patients now do phone consults. We're going to do curbside pickup for the supplements. If you are sick, we're going to screen you. Maybe wear a mask. We're going to wear gloves. Just have to be really preventative now.
And I don't mean to put you on the spot, but I do want to ask you here as a doctor, just to give folks some perspective, the swine flu, 61 million Americans came down with swine flu.
Yes.
13,000 people had to be hospitalized. I'm sorry, 300,000 had to be hospitalized. 13,000 Americans died.
Yeah.
The numbers we've seen so far, granted that was for a whole year in 2009, with the numbers with coronavirus are nowhere near the swine flu numbers. So I don't recall the the
gravity
response.
of the situation.
Yes.
Yeah.
How do you account for the difference?
This is what we're really trying to figure out. And we're not sure if we're getting all the accurate information from the Chinese government, because this is where it started, right? We always have to trace it back. It started in Wuhan, the Hubei province. We don't know too much about the virus. We're calling it a novel coronavirus. We know the coronavirus is a common cold virus, but this is just so radically different. And I think the problem is we don't have a handle on what the molecular structure is and what is actually going on. One thing I know from my research is that the rate of replication and the viral shedding is so drastically much higher than what we saw in SARS in 2002 and the MERS in 2012. It topped out at 8,000 cases with SARS, and we're well over 150,000 cases here with coronavirus. So this is something we've never encountered before. We're probably never going to, just never had any experience with this.
The fear of the unknown.
Fear of the unknown and developing something. I mean, they're not even talking about vaccines coming out till 2021. So this is why prevention, boosting the immunity is going to be key. There's nothing else we can do. It's being aware, socially isolating ourselves, flattening the curve, and just taking those preventive measures. I just urge all my patients, if you have, medical issues, if you're immunocompromised, please, just make sure that you boost your immune system, eat well, get enough rest. And I have to say something else. This is the physical sense we're talking about. This is going to take a mental toll with what's going on. It's going to affect a lot of people. Stress, anxiety, insomnia is going to go up. All these are going to lower our immune system. So I'm telling my patients, just take what you can take naturally. I'm, here to help. And, physicians, we are frontline, and we are putting ourselves at risk to help, the patients.
Absolutely, and we certainly appreciate you being here and the information. Thank you again, Doctor.
Thanks.